Kendra Mahaswamiji. A very good morning, one and all. Myself, Dr. Suma KJ, Assistant Professor, Department of Panchakarma, JSSAMC Mysuru, would like to welcome you all on this online webinar on the topic application of effective Ayurveda treatment in different conditions of psoriasis, tinea, and eczema. Now, I would like to request Dr. Sita Devi Madam, Reader, Department of Panchakarma, JSSAMC, to welcome all. Please, Madam.
Namaste, MYTHREY Madam.
Namaste. Namaste, Dr. Sita.
Pranamas to the lotus feet of His Holiness Jagadguru Sri Shivratri Deshikendra Mahaswamiji. Good morning, one and all. I heartily welcome Dr. MYTHREY, Department of Professor, Department of Kaya Chikitsa, JMC Mysore, to this webinar. Hearty welcome, Madam.
Thank you.
And also, I welcome teaching staff, all the PG scholars, UG scholars to this webinar. Thank you.
Thank you very much, Madam, for that welcome. I also welcome you on behalf of the department. Now, I request Dr. Manasa, Assistant Professor, Department of Panchakarma, to kindly introduce Dr. MYTHREY to the gathering. Please, Dr. Manasa.
Namaste. Thank you, Dr. Suma. A very good morning to one and all. Seeking the blessing of His Holiness Jagadguru Sri Shivratri Deshikendra Mahaswamiji, I, Dr. Manasa SD, Assistant Professor, Department of PG Studies in Panchakarma, take a great pleasure to introduce our guest speaker for today's session, Dr. MYTHREY RC Ma'am. Currently, Madam is working as Professor in the Department of PG Studies in Kaya Chikitsa, Government Ayurveda Medical College, Mysuru. Madam is an excellent academician and clinician and has more than 15 years of teaching and clinical experience with specialization in treating dermatological conditions. Madam did her BAMS and post-graduation in Kaya Chikitsa from JMC Mysore, PG Diploma in Yoga from Mysore Vivekananda Yoga Education and Research Institute, PG Diploma in Cosmetology from Indian Institute of Aesthetic Medicine, Pune. To upgrade to her knowledge, she has also undergone various additional training in pharmacovigilance, short course on clinical pharmacology, so on, so forth. Madam has guided more than 20 PG scholars and has been a resource person in many workshops, conferences, and been an organizing member for more than 5 conferences. Nodal officer for SCP TSP program, Government of Karnataka, and has given talks on air as well as TV shows. Adding to her achievement, she has received gold certificate on appreciation for participating in Yogathon Challenge on World Health Day, organized from Art of Living. Was a co-chairperson in National Seminar on Healthy Lifestyle by Arogya Bharati, as a credit of conducting 2 successive national integration camps through NSS at Mysore. As a feather to her cap, she has been awarded as a Best NSS Program Officer for the year 2014-15 by His Highness Governor of Karnataka, Vajubhai Vala. Other than clinical and academic experience, she has also served as an hostel warden, NSS Program Officer, member of Red Cross Society, life member of Kannada Sahitya Parishad. Madam has also published nearly 6 books on health and more than 30 articles in national international journals. We are honored to have such an eminent personality with us. I now request Dr. MYTHREY Ma'am to kindly take over the session. Madam, please.
Thank you, Manasa. Yeah. Dr. Manasa, for giving my lengthy introduction. I'm thankful to you. So first of all, I extend my thankfulness to Dr. Sarveshwar sir, Principal, JSSAMC, and Dr. Veena Madam for providing me this opportunity to share my knowledge with the wonderful students of JSS as well as from other parts also. So,
Heartily welcome, madam. Heartily welcome.
yeah, thank you, ma'am. Okay. I can start slideshow also, right? Yeah. Okay, I'll with the based on my field of interest related to dermatology and cosmetology. Today's my topic was to share my knowledge regarding the effective application of Ayurvedic treatment in skin diseases, especially of psoriasis, tinea, and eczema. That too, we overcome very frequently in our OPD. Okay, there are a lot many cases, but these three conditions I chose because we come across these conditions very often. We usually see about 60% of 60% of dermatological cases in our OPD related to these three conditions too much. Okay, so I thought what effective treatment we think it is effective for us because we are finding good results, and based on that, I thought I would share the same with other students and faculty also. Okay, so skin, it is a biggest organ. Skin is a very delicate organ. Excuse me, ma'am, am I sharing properly? Hello.
Ma'am, your screen is not visible, ma'am.
Yeah, what?
Screen is not visible.
Okay, I'll just close and start again.
Yes, ma'am. Yes, ma'am.
Now?
Now it is visible. Ma'am.
Now it's visible, right? Yeah. Yeah, fine.
Yes,
Now.
ma'am. Yes, ma'am.
As to continue, I was telling that skin is a very big organ. It's a very delicate organ. And whatever happens to skin or whatever, say, changes we come across in our health, that is expressed on the skin. That's why we can say that skin is like a mirror. It reflects our inner health. If our inner health is fine, that glow, that healthiness is evidently noticed on everybody's or that particular person's skin, is it not? So what you consider that person's skin, if the person's skin is so fine, so healthy, in our terminology, in Ayurvedic technical term, we use that sarata or rakta sarata, because rakta is very much or very intricately linked with the tvacha or rasa. So when these two dhatus are so potent, if they are so sarabadda, sarayukta, then the quality of the skin will be like snigdhata. You can identify the quality of qualities like snigdhata, slakshnata, mruduta, prasannata, even sukumarata. Though it is delicate, it is so healthy, and there will be less loma and prabhayukta. Okay, along with all these lakshanas, if the person is rakta sarata, if his rakta is so pure and healthy, then that effect on the skin will be seen as sukha. It is so nice to see, and it has the potency of tolerating any kind of bala or klesha or ushnata. Okay, like why this terminology is because see, the skin is, when the skin becomes so delicate, when the skin becomes so sensitive, it develops the tendency to get into some diseased condition. Okay, so whenever the skin is sensitive, it cannot tolerate the mildest changes or mildest ushnata. Even if you are exposed to sun, the condition aggravates. So if that is not the case, then if it is healthy, then it is Sara Lakshana. It is so well identified. So to have such beautiful skin, no, I always quote when all my skin presentations, I always quote this common dialogue. Very few people are blessed with naturally perfect and beautiful skin. I think you all agree with this, right? So once the skin damages, it's damaged. So if you're not having such a healthy skin, so if you're having the tendency to develop a skin problem, so what happens, or why, what is the reason for it? What causes the skin to get damaged? Very briefly, I have highlighted here. It is a weakened immune system. If you are coming in continuous contact with allergens or irritants or contagions like fungus, parasites, or microorganisms, it may be because of bacterial or viral infections. It may be because of few health conditions or lifestyle factors. It may be due to stress, due to lack of sleep, climatic changes, environmental pollution, vitamin deficiency, allergic tendency, and genetic factors. There are plenty of causes, but these are highlighted here. So what will be the effect of these causes? Effect of these causes is naturally your skin is damaged. Then if you develop skin problems, then that impact of that condition will be very severely affected. Very severely affects the person, okay, because it initially it disturbs the psychological state, and later on it disturbs the social relationships, and you shell down lot of money to just to get cure of the condition, just to make you look good, just to make your skin to become normal. So it is naturally finally turns into financial burden. Okay, so in our we should not forget our causative factors, like in the sense Ayurvedic causative factors. Ayurvedic factors are still more precise, or still more specific, that these reasons, these aharajari reasons and viharajari reasons will definitely cause rakta dushti, and then the effect will be on the skin. Okay, so based on the aharaja nidanas, I think I need not go into the nidana in detail, but very commonly we know very frequent use of lavana, or too much usage of lavana rasa, amla rasa, and masha, tila, okay, and chilchima fish. Matsya is also not indicated, but especially chilchima fish, with if you're combining that with milk, which comes in the Viruddhahara concept, that has a direct reference that it causes skin diseases. Okay, likewise Viruddhahara, Satmya etc., etc., all aharajani danas, but it starts vitiating the rasa and rakta. Okay, so simultaneously there will be kleda vriddhi and snigdha ushna guna of other food items. If you're consuming more, it all counts as the causative factors. And even coming to the Viharaja Nidanas, like Kale Anavasechana, if you are not getting into the timely Shodhana. See, I always tell my students that if we Ayurveda students or we Ayurvedic people don't follow, who else will follow? Because we know the concept of getting purified, making our body purified at particular time. Like we have the concept of Rutu Shodhana, or don't wait until you develop any disease, but before the development of the disease itself, to keep yourself healthy, you have so many technical theories that you should adopt to your body, and then make yourself fit and fine. So if you're not undergoing that one, that also counts for the accumulation of the doshas, right? So that is one of the reasons for the skin disease also. And if you're using sneha dinamsha ayata arambham, say in Panchakarma, if the snehapana, actually snehana chikitsa itself is contraindicated for Kushta Roga, but still once the disease is fully fledged, treatment starts with the sneha itself. But still, if that snehana procedure is not done properly, or if it has some imbalance therapies administered, then that will be a direct cause for the production of the skin disease. Then Chardi Vega Pratigada, we have the direct reference for this. Here, Chardi in the sense it's not just vomiting. You should also consider for the other lakshanas involving the nausea. You can consider for just nausea, which has developed because of ajirnata and amla pitta. Okay, it may not be pure chardi roga itself or chardi condition itself. It may be the earlier or associated conditions of that particular expression. If you are controlling that one, then that again initiates the doshas and it will causes skin diseases like Visarpa, Kota, Kushta, Akshikando, and Venga, Kshudra Roga. One of the Kshudra Roga, Venga is indicated if this is controlled. So you should not do those things. And if you don't come under and across these ahara and vihara janitanas, if it happens, what is the effect on the skin? Then the skin is targeted. Okay, the doshas gets vitiated, and we have such a beautiful samprapti shlokas saying that trayo doshaha yugapat prakopam apadyante tvagadayaschattvaraha shaitilyam apadyante teshu shitileshu doshaha prakapitaha sthanam adhikamya santishtam taneva tvagadindushendha kushtani abhivartayanti. Okay, so the doshas, it is not that there is accumulation of the vitiation of the doshas, and one particular time what happens that all the doshas gets vitiated, all the doshas together they come across and it vitiates the tvacha and it leads to skin diseases. So if this is the condition, it is now you are identified as we have a rogi of tvacha roga. Okay, so now you have to balance it. Now you have to make it proper. You have to make the skin to come to its normal texture. So what are all the clinical examinations we have to do before applying the proper treatment? Okay, so we have to check for the lesions, what type of lesions, whether it is primary lesion or secondary lesions. Like that, we have all the information regarding the lesions, its distribution all over the body, whether it is restricted to only particular part, or are the lesions are getting enlarged, coalescing all together and forming a big lesion. Whatever all these conditions, you have to very keenly observe to apply your treatment. Okay. Then go for the history, what occupation, whether his or her occupation is promoting the increase in the conditions, disease condition, or is there any history of allergy, or the skin has become very sensitive. See, sensitivity of the skin, we talk only for the lines of allergic reactions, but later on, even in autoimmune conditions also, once the skin becomes so sensitive, only then the disease will be shown as it is deep dhatu seated. So there, the sensitivity level of the skin also has to be assessed, and you have to, along with that, you have to see for the general nutrition and general health condition of your patient. Go for any systemic diseases associated that also contributes for the aggravation of the condition, and the mental status of the patient has to be checked. Okay, and the same methodology, if we concentrate on our technical terms, it should be like you have to identify the proper dosha which is involved. Usually it is stated that it is tridosha, Kushta is tridoshaja, but still for the particular treatment to apply, we have to go for which dosha level is higher. Okay, and which guna of that particular dosha is higher, then to what level of the dhatu this disease has reached, and tivrata of the lakshana. Then you have to identify, for here also we have to go for any associated diseases, which is hindering us to put the proper treatment. Then, and it's a common thing of testing the patient, you applying the Shabita Pariksha Bhavas. Okay. Now with all these applications of information, you have diagnosed as a skin disease, and now you have to plan for the treatment. Okay. So how you will manage the kushta, or in general, I always avoid using the term kushta, because in the place of kushta, I always put it as tvak roga, tvak vikara, and just go with skin disorders. Okay. So we have a common protocol of Nidana Parivarjana, Shodhana, Shamana, Rasayana, and Patisana. This is very common. Everybody follows this routine. But still, before going into the appropriate particular treatments, I will again just go with the very basic treatment principles or concepts for which we have to apply for kushta also. Okay. Although all kushtas are tridoshaja, as I said earlier, the treatment should be planned depending on the predominance of dosha, as understood by there. features. Okay, as the doshas, for example, if it is vata predominant, then the karata, rukshata will be more. Then to what level your snehana has to be administered. So all this you have to fix, no? So that you have to see the level of doshic variations, whether it is associated with pitta or kapha. If it is associated with pitta, which is more predominant, either pitta or vata, like that, you have to understand, very keenly observe the lakshanas and then understand which doshic variation is there. Just all these information is to put the proper treatment. Okay. So continuing with this, all kushta should be treated with snehana on priority basis. See, I think in my second or third slide, I said that sneha chikitsa is contraindicated. Even in nidana, ati sneha ahara, snehaja intake is contraindicated. But still, in kushta, once the disease has developed, treatment of sneha chikitsa will be very appreciable. But in this snehana chikitsa, as we know, it is useful for vataja kushta. But for vataja kushta, we don't find any particular gritas or thylas. Okay, so there is an indication that you have to process, you have to prepare particular grita wherein vatahara dravyas are used and grita is prepared, or even thyla is prepared. Thyla is also beneficial, but in our practice, what we are saying is grita is very much beneficial. If it is vataja type of kushta, then the medicines used to prepare grita should be of vatashamaka properties. This is a common concept. I think it's again a reminder. That's it. When there is minimal doshic vitiation, the condition can be overcome by Langan and Pachana method. See, if the patient himself or herself is very keen on the skin, on his or her skin condition, a small or very minute change anywhere on the body over the skin. If he identifies itching, all skin conditions starts from itching. Kandu is one of the very bad lakshana, very difficult to control this kind of lakshana. It starts with this kandu initiates the skin disease and it stays the whole phase of the disease process until and unless even the patient feels that his skin is becoming normal. Even then kandu retains. Kandu is such a uncontrollable thing for the patient himself and uncontrollable lakshana for the doctor also to control it, because we have kandugna mahakashaya dravyas with us, and though we prepare the kashaya or grita and administer to the patient, controlling kandu is not so easy. So for that, very tactic management has to be applied. Let us tell it in the future slides. And what I was telling is, very early condition itself, you have to identify for small pitakas, or kandu, or any discoloration on the skin. If you're seeing it repeatedly, yesterday also I got this, again today I'm feeling some uneasiness on the skin. Such level, if your patient identifies, then immediately start off Langan and Pachana treatment. Okay, because there and then itself you have to clear off the conditions. That would be very easy, because treating skin disease is not so easy thing. See, scratch happens very quickly. Just a move of my nail over my skin, I get a scratch. But after just a second, not even a second, I could get a scratch. But for healing this scratch, it takes many days or months. Even sometimes it can aggravate, it can increase, and it takes years also to get cleared. That's why earlier treatment, starting with Langana or Deepana Pachana therapies, and if the patient is fit and fine, administer Shodhana, then there will be then and there itself you can cut off the future disease process. That is very important. And it is important for the patient also to notice in the earlier days itself, or else when we get a lot of patients after they have made their condition chronic, then it is a little difficult itself. Okay, and all effort should be made to clear out the mala appropriate time. This is also told before, and too much of their accumulation leads to their aggravation and even shortening of life itself. Sanchita dosha, this is Rutu Shodhana. I think I need not explain this. Everybody knows this. Better to follow this even in non-diseased condition also, so that you are keeping your skin very healthy and not getting any diseases born out of any season. Okay. Vasantika Vamana, Basti in Varsha Rutu, Virechana in Sharad Rutu. And coming to the Dhatugata Kushta Lakshana, if you identify the level of where the doshic variation stays, if you're very keen, if it is in the Tvagata, then go for Shodhana and Lepa. If it is Raktagata, go for Shodhana and then add some Shamana Aushadhi. And here Raktamokshana if needed. See, Raktamokshana can be a last resort when all Shadupakramas is not working, then Raktamokshana can be one of the best option. But even in earlier conditions also, ಸ್ವಲ್ಪ ಅಲ್ಪ ಪ್ರಮಾಣದಲ್ಲಿ ಸ್ನೇಹಪಾನ ಮಾಡಿಸಿದ ಪೇಷಂಟ್ಗೆ ಅಲ್ಪ ಪ್ರಮಾಣದಲ್ಲಿ ರಕ್ತಮೋಕ್ಷಣ ಮಾಡಿಸಿದ್ರು ಕೂಡ there will be good results. And for Mamsagata Kushta, all the above plus suitable Asavarishta addition. And for Medashruta Kushta, here it is deep-seated already. Here the treatment becomes little difficult. And most of the cases or most of the chronic conditions we get for the patients will be already in the Mamsa and Meda Sthita level, Meda Dusha level. Okay. So here, naturally, all classical treatment has to be administered. Then never forget to apply. Or here, Ballataka, Kadiragupulu, Chiladaku, Tuvaraka, these kind of medicines needs their intervention. Okay, and then going beyond it, Asti, Majja, and Shukra, it is little difficult. It is difficult. Kushta is the classical example for Tirya Gati of dosha. So Tirya Gati means Shodhana Marga Pratyachya Sthitaha. See, one, it is not in the these doshas in Kushta, it stands adjacent, not adjacent, perpendicular to the Shodhana Marga. So it will become very difficult in elimination of doshas. So that's why repeated or elimination, very frequent elimination of doshas is indicated in Kushta. Okay, then it's about Kramata Shodhana and Puna Shodhana. I think everybody knows this shloka from Shishruta. Every 15 days once Vamana, once in a month Virechana. Nasya every 3 days once if the pathology is more severe above the Jatrurva, and Raktamokshana if needed once in 6 months. Okay, so in Utklishta Doshavastha, if you cannot wait for a classical Shodhana therapy to apply, and if you find that the dosha is too severe, you need to immediately put it out. Then for Virechana, we have two commonly used yogas, that is Nimbamrita, the Erinda Taila, we use around 20 to 30 ml. Sometimes we need 50 ml also, depending upon the cost of the patient, once a day with Shuddhi Kashaya. Don't forget to administer along with Shuddhi Kashaya, because this later on increases the Vata dosha. Okay, and even if it is Pitta associated, then administer Avipatikara Churna 10 to 15 grams with lukewarm water. For Vamana, you can administer Karavelaka Swarasa or Vasa Nimba Patola Muna Swarasa, or instead you can use Vata also. Okay, and we have wonderful one more Shodhana, Ubhayata Shodhana Dravya, that is Tuvaraka Taila. We use 1 karsha in the morning along with the food for 5 days. This is a typical classical reference, even we adopt this, because here we are supposed to use this, what I'm telling is along with the food, and because Tuvaraka is so tikshna, after around 3 to 4 bolus of food, after consumption of it, then Tuvaraka Taila in midst you have to administer. And after 5 days, then daily for 15 days, we have to administer Mudika Yusha or Odana with Mudika Yusha as Patya. Okay, so this Tuvaraka, it is, we use Tuvaraka for the Shodhana, we use Tuvaraka as Shamana, and the effectiveness of Tuvaraka is very wonderful. Very keenly it has to be administered, and it has some studies. Now I have also gone through it. In very direct contact itself, I have gone through the study, and I've seen that there is histopathological changes also, histopathological healthy changes after intervention of Tuvaraka. But compared to the Shodhana, Tuvaraka effect is very good, but administration of it is, it has to be done under very experienced hands. Okay, so with this basic treatment, minimum basic information, I'll just go with the particular diseases. This is the psoriasis condition. Everybody, I think I might have seen this. It's a non-infectious inflammatory disease characterized by well-defined erythematous plaques. See this plaques with scaling, it is the significant, or this is the one of the evident symptom of psoriasis. So this, as I said, this scales or plaques which comes out. Why this happens? This is the commonest reason. Based on that only, why we diagnose it as psoriasis. In psoriasis, an activated immune system triggers the skin to produce every 3 to 4 days once, building up on the outer layers, that is on epidermis and keratin. Every 3 to 4 days once, this immune system triggers and develops the skin to become thickened because of the keratin flow, and blood flow also increases and it reddens the skin, and there will be the formation of silvery gray scales. And once it is formed, it starts shedding off. Once it is shedding, once you come across your patient is shedding off a lot of scales, then he is getting into complication. He is depleting a lot of protein also. So all these things you have to take care before giving treatment, or along with your treatment. Okay, this is a stable plaque psoriasis. This is one of the commonest type of psoriasis we come across. Lesions are very well defined, erythematous and scaly plaques. The shape and size vary. As I said, see in the second photo, you can see the lesions are all coalescing, joining, and all are joining and becoming a very big area. It's covering a big skin area. Okay, the lesions usually appear on the extensor aspects of elbows, knees, trunk, and scalp. So, what is the management? How this management is? From here, I am sharing our management, what I do in my department, and followed by our students also. See, for all skin disease, Shodhana is fixed. Okay, Vamana, if you can administer Vamana, fine. Then again, after Vamana, you follow with the Virechana, classical Vamana and Virechana therapy has to be done. For the Deepana Pachana, if it is Vata predominant, we use Ajamodadi Churna. If it is Pitta predominant, we use Jirakadi or Drakshadi Churna. Or we mix Jirakadi plus Panchakola Churna. And if it is Kapha predominant, then we go with Trikatu Churna. Okay, and for after Deepana, what Agni Deepta Lakshana is found, then Snehapana we use, commonly we use Panchatikta Krita, Mahatikta Krita, or these two we use more. If Kapha predominant is there, we add Kukulu Tikta Krita. Okay, and for Bahya, Snehana, Bahya Abhyanga, Sarvanga Abhyanga, and Mrudu Svedana, because Svedana is not, you cannot give a severe too high Bashpa Sveda for psoriatic patients or any skin patients, because you know it increases Kleda, and if Kleda is increased again, it enters the deeper dhatus and the condition aggravates. So Mrudu Svedana. Then if you're planning for Vamana, common Madanapala Yoga, or for if you're planning for Virechana, again commonly we use Trivikraya. Okay. After this is a common Shodhana therapy. I think I need not explain this. This is a common protocol what is followed for almost all the skin disease. Okay. Sometimes based on the dosha variation, the medicines are changed. That's it. Okay. For Shamana, this Karanja Arka, usage of Arka, we have started using Arka. It is giving good results. Karanjarka 36 ml in 3 equally divided doses. It is around 10 to 12 ml for per dose, 3 times a day. It may be for 20 days, or you can continue even for a month and then stop. By that by those days, Lakshanas almost the skin would have become very, very much normal. Okay. And for externally, even Karanja Bija Taila or Putaja Patra Surya Paki Taila, that these two are very commonly used. And if your Arka preparation is not on hand, always readily available, then Atarusha Kadi Kwata, which we get it prepared ourselves, that is also administered, and that is also giving good results. Okay. Even Kutaja Siddha Haritaki Churna, Churna Yoga, if you are wishing to administer Churna Yoga, then this Churna is fine. And externally, Vyadignadi Taila is also fine. And well, applying this Vyadignadi Taila, just see to it that Kapha Vata Pradhana conditions responds well. If it is associated with some Pittaja Lakshana, there will be little irritation. but very cautiously we were using this, and but we didn't find any complications while using Yadignadi. Even in Pittaja Lakshana also, though this Taila contains Mallatika Tuvaraka, application was very smooth going. It never hurted, or we are still continuing it. Okay, this is gutted psoriasis, lesions of sudden eruptions, small erythematous and scaly papules. Later, sometimes persist to form plaque type of psoriasis also. Gutted psoriasis is believed to be an immune complex disease. See here, already psoriasis is an autoimmune disease, but still gutted becomes little difficult because of the based on the reason as well as the lakshanas. It sometimes may be precipitated by streptococcal throat infection or cutaneous bacterial infection. So here for this management, classical Virechana, Snehana, we opt for Panchatikta Grita itself. But sometimes if there is bacterial infection, Vidangadi Grita is also added. We mix Tiktaka Grita and Vidangadi Grita and administer. Okay, and mixing, I usually do a lot of mixing for all asavas. I do mixing for churnas. I do mixing, and for grutas I do mixing, and even for external application tailas I use mixing. Just one day when the yogana balsava ಸ್ವಲ್ಪ ಎರಡೆರಡು yogana mix ಮಾಡಿ we are doing it, and it is showing good results. Okay, and after Samyak Snigdha Lakshana is found, then plan for Virechana. After Virechana for gutted psoriasis, as because this here the lesions are little thick and little adamant. Here, compared to stable plaque psoriasis, gutted lesions are little deeper, little stronger. Okay, so and infection rate will be little higher compared to this plaque psoriasis. So here we may need Dushivishadi Gulika if required. See the condition and then apply Dushivishadi. It's not a regular prescription for us. And Swarnakshiri Swarasa, if it is available at that time when the patient is there, we definitely give this 10 ml with 100 ml of milk early morning, empty stomach. Yeah, we usually fix this Tikshna Dravyas for 20 days or so, 20 days to maximum 1 month or so. 20 days, I think it is sufficient, and it is giving good results. Okay. After that, Guruchadi Pata you can administer in the afternoon dose or in the night dose, 90 ml with 3 equally divided doses. Guruchadi Quata has shown good results for almost all the skin diseases, not only for psoriasis, but almost all the skin diseases. Okay. Here I have mentioned Surya Paki Kutajataila for external application. External application can be of your choice. Whichever soothes the skin of the patient, that can be continued. So this is palmoplantar psoriasis. Next one is flexural psoriasis. Very irritating, very itchy condition, very difficult to do any normal routine work. So in these conditions, if it is restricted only to palmar region or plantar region or only to the flexure area, in the sense it will be not little deeper. Okay, so plan if Shodhana, if it is needed only, then we plan for it, or else just with Shamana Chikitsa, results are available. Okay, here in these two conditions, we prefer to go for Shamana Sneha Chikitsa. Again, go with the Panchatikta Krita or Amrita Adhikrita. See, Amrita here, Amrita and just Guruchi and Shruti, we are using only 2 dravyas in that Krita. It is prepared and administered, and for 15 to 20 days, within 15 to 20 days, we are getting good results. Even Panchavalkala Krita, we prepare ourselves. If there is cuts and if there is bleeding, then in that condition, we prefer Panchavalkala. Okay, Shamana Sneha, you are giving 30 ml, around 20 to 30 ml of Sneha Dravya early morning with lukewarm water, and after it is digested, then the patient can have his food. Okay, then in afternoon dose and night dose, go with Panchatikta Kashaya, Nimamrita Kashaya, Sanjeevini Vati with Shuddha Gandhaka. If there is infectious bleeding and infectious status, then go with Shuddha Gandhaka. And here Ashwagandha Churna is added because if it is related to hand, if it is related to your palm, it is though skin disease itself is a problematic condition. If other parts of the area is involved, then if you compare the areas affected, if it is palm, it is little mentally restricted. See, because the person cannot have his food also, no, he cannot carry anything in using his fingers and his palm. So it irritates his mind a lot. We have seen the patient with varied or difficulty or the variation in their mental status, or more of palmoplantar psoriasis persons rather than other conditions. Here, not 2 points will be more seen for palmoplantar psoriasis condition. So there we add ashwagandha churna or ashwagandha rasayana also. It balances, it acts as rasayana, it promotes the earlier healing, and as well as it might help the patient's mental stability. Okay, and externally we advise Panchavalkalakvada avagahana both for hands and feet, and after avagahana sveda, the water content is removed, wiped off, and Jivantyadi Yamaka is applied. Okay, that is wonderful. The results are very wonderful. See, and this is pustular psoriasis, indicates high degree of inflammation where the micro abscesses become large enough to be visible clinically. So here, especially Shaddarana Churna, Trikatu Churna, we usually will have kapha pitta lakshana. So these two Dipana Dravyas are option. Kaishora Guguru Sutshekaravati Gandhaka Rasayana is a common prescription here. Mahamanjishta Dikara Kadira Ishta. Okay, if at all there is severe infectious condition, then opt for Rasamanikya 125 mg once or twice with Grita. Though there is pustules, is Grita needed? Yes, it is needed for Rasamanikya properties. Okay, very 1 or 2 drops of Grita you should add, and then go with Amrutottara Kashaya or Guruchedi Kashaya here also. And if there is Jwara because of any infection, then you should add Chandana Yukta Paripathadi Khada. See, Paripathadi Khada is available outside. For that, you can add Chandana, Chandanasava also, or Chandana itself, Chandana Jala, and Paripathadi Khada can be administered. Okay. So, this is the exfoliative psoriasis, very difficult for treatment, uncontrolled erythroderma with scaly lesions, and if it is uncontrolled status of scaly flakes going out, lot of protein depletion will be happening and the patient can be fatal. Okay, so and because of the generalized vasodilation, the skin loses its ability to control the loss of body heat, and therefore he develops chills and rigors. Okay, so management should be very careful. Start with Shamana Chikitsa. Don't plan Shodhana immediately. We start with Shamana Chikitsa because in these conditions, allopathic line of treatment will be immediately they start with steroid therapy. Okay, but we in our style start with Shamana Chikitsa. You go with Ajmodadi Churna, Jirakari Churna, and then if it is too dry, then the same drugs in the Grita form can be administered, or Panchakola Grita plus Kuruchi Grita should be administered in Shamana Sneha form. Okay, and then go with Aroki Vardhini Vati with Mukta Basma. Here we had Mukta Basma, and if there is Jwara, against Amrutottara Kashaya. And after some days, after the Jwara has come down, start with Kadirarishta Sari Vadyasava, Mahamanjishta Vikarasi. As I said, I go with the combination plus specificates. All the 3 Asavarishtas are added and diluted with water and administered after food. And externally, here Anna Lepa is done. For this little Taila, either Manishtari Taila or Nanpamaradi Taila can be added, or go with just plain Tila Taila. And little actually Anna Lepa with Haridra is done. That's why if Haridra if you cannot add, then you can add Nanpamaradi Taila also. And just after application, it is for only 20 minutes of application for the whole body, because in this condition, the whole body would have been involved with the scaly lesions. And after Anna Lepa, you just cover the body with the banana leaves for 20 minutes. Okay, and see the improvement. If there is changes in the skin condition, then continue, or else make it alternate days, or just see whether this therapy helps this particular patient or not, because some patients will never respond for any sort of treatment. Okay, so with all these lakshanas, once the condition is stable, then plan for Shodhana. See, these are the photos which of our institution, what we have done. This is before and after treatment. Few photos I'm sharing here. See the behind ears and the lesions is so thick. Okay, after treatment, she has got good results. This is the lesions in the legs. This is over the trunk and hands. See, in this particular case, after Shodhana, his tummy, this patient's tummy also became so normal. A very keratinized condition that is also showing some results. Okay. Happy with the results. Now coming to the next condition, that is tinea or it has different terminologies like dermatophytosis or fungal infection or ringworm condition. Okay, this is because I think this is because of fungal infection. It is very highly contagious. Okay, it spreads from one person to other person. If don't share, the person should never share the clothes, their eatables, nothing, towels, soaps especially. Okay, nothing should be shared. And based on the area or different area of its presentation, its names varies. Okay, we have multiple of tinea. We have varieties of tinea like tinea corporis, tinea barbae, tinea angium, tinea cruris, tinea capitis. Like that, we have based on the places where it occurs in the body. It has different names, and the treatment almost is similar. Okay, it is seen more in humid climates, and it is seen in the patients who sweat a lot and who doesn't take care of their skin, keeping themselves clean. Okay, so for management here, it is hygiene is very important. As I said, every day their clothes has to be washed with Dettol and hot water. It is dried in under the sun. That very hygiene condition has to be maintained a lot in them. And then Vidanga Arishta is the prime medicine here advised. Vidanga is such a beautiful drug, you know. We very broadly learn it as just Krimihara, but it is antifungal, antibacterial, anti-whatever, anti-any germ. It is beautiful. Okay? It gives very good results. Even we have noticed that Kandu has also come down after administering Vidanga Arishta. Go with the combination like Vidangarishta Sarivatyas or Vidangarishta Mamajishta Vikada or Kadirashta. As such, you have to see the condition of the patient and then make a combination and administer, but keep Vidangarishta as a prime drug here. Okay, and after I say you have choices to use Patola Katoroidia Dikashaya also for tinea corporis. Maintaining, managing it and making it normal is not so easy. Tinea is also very difficult, very rigid. It shows improvement, but immediately once the patient scratches again on contact with anything, even a cloth touches, again, if the patient scratches and all the same old lesion recurs back. So it is, you have to be very careful. And here the patient every day has to take bath with Snana Churna. Kusuma bathing powder or Siddharthaka Snana Churna, which is available in the market, both are wonderful. But the problem is that these two powders makes the skin dry. So you have to advise your patients to add half quantity or equal quantity of green gram flour, not basin flour or not kadle hittu ala, hasra kal hittu, because that green gram flour is very soft and it reduces dryness. Okay, and if the itching is more, then go with scrubbing materials like make the same powder very coarse and ask the patient to get clean, get his skin clean by this. Don't advise your patients, any of the skin patients, to use hot water to take bath, because they feel that they feel comfortable by pouring hot water and they go on pouring hot water. That is very wrong concept. During that process, the patient will feel so happy that his Kandu is under control. But what happens immediately is it aggravates the doshas, and after you are out of the bathroom, all your lesions aggravates. So it should never happen, and all patients should go for lukewarm water bath or cold water bath is very, very good. Okay, after Snana, then if the skin is so dry, then I advise Thaila application like Narpa Maradi Thaila or plain coconut oil, or you can add Marichadi Thaila to the plain coconut oil and apply over the dry area. And for dusting, cutis dusting powder is available in the market. It is very good. Main ingredient is nimba, karpura, etc. It is very good. And even you can apply Chakramarga Thaila externally during night times. Gandha Karpura ointment and Trichoderma ointment, which is available also as antifungal, they are also very good. But my prime choice is Tankana Basma, Yashtimadu, and Harita Kichuna. This combination is wonderful. Just mix this with rose water or plain water. If the skin is very dry, just put 2 drops of Tila Taila, make a paste and apply. And Kandu is very much controlled, and the discoloration, what happens because of this fungal problem, that discoloration also gets normalized. This is very good yoga, you can try. Okay. And see, this is the before and after treatment of tinea condition. This also a big lesion in over the forearm, and it is removed. Now coming to the eczema, I think I should make it fast. Eczema, you know, there are varieties. We find acute eczema, chronic eczema. These are the little identification symptoms. And we have endogenous eczema, exogenous eczema. In exogenous, we have irritant contact eczema and allergic contact eczema. Irritant is you're coming across some irritants like detergents, alkalis, acids, etc. Allergic is allergic condition is you are coming across some items like nylon, cloth, shoes, socks, jewelry, cosmetics, hair dye, etc., which on continuous usage makes your skin to develop sensitivity. Your skin becomes hypersensitivity, and after that sensitivity phase has attained in your skin, then the patient starts developing itching, scratching, and pustules, papules starts erupting, and there the allergic dermatitis sets in. Okay, so once there is hypersensitivity, once the patient enters the sunlight or exposed to the sunlight, his condition aggravates, and it can be associated with photodermatitis also. Along with other skin condition, it may be photodermatitis also. So managing that condition is not so easy. So this is airborne contact dermatitis because of airborne plant components. This is Parthenium. The pollens of Parthenium will be in the air, and if that comes in contact with the skin becomes like this. Bitterol exposed area, it becomes like this. So how to manage this? Allergens should be kept at bay. You should identify what is causing allergy to you, and you have to be away from it. That is a prime treatment. Then Shodhana based on the severity. See, this is an external reason. So here Shodhana is not showing us very good result. Even only Shamana is helping us. But depending upon the doshic severity, you can advise Shodhana. And Manjishtadi Gita, we prepare ourselves and we administer this with, as a Shamana Sneha. It's wonderful. Navakvata, 90 ml in 3 divided doses. That is 30 ml in 3 doses. 30 ml per Annakala. And then Lagu Sutashekaraviti, Adushi Vishari Kulika. Externally, we use Manjishtadi Thaila, Brahad Marichadi Thaila for external application. Mixed, both the oils are mixed. And once the itching condition, once the lesionic condition is stable, then to give the color back to the skin, because in eczematous condition, the skin becomes dark. Okay, once the lesions have gone, then to get back the vernia, you can administer Kumkumadi Thaila plus Yashtimadu Thaila and massage. Okay, so this is the before and after treatment. This is one of our patients. Here, this photo is immediately after the Shodhana. You can see the neck area and the forehead area. There is slight improvement, and this is a airborne contact dermatitis case. This has taken a lot of days to become normal. Okay, and this is kumkum allergy. You can make out after the Shamana treatment, after 1 month of treatment, his forehead is normal. Endogenous eczema goes with atopic eczema because here the reason will be internal, like Aharaja Nidana or genetic factor, or already having curvy gunata in the skin, then atopic eczema is seen. Okay, so xerotic eczema, seborrheic dermatitis, varieties of eczematic condition. For all that, you can plan management like Gandhaka Rasayana, Dosha Vishari Gulika, because there will be Srava. If it is Srava, then Gandhaka is must. Okay. If it is dry, then add to your treatment. Okay. Vidanga plus Kadira Churna, Panchatikta Dravya Kashaya is advised. And most of the cases, 6 Sneha in Shamana form. As our experience goes, we have seen most of the eczema conditions. Initially, matra srava irutte, or if the patient scratches too much, avaga matra srava irutte, illa andre we can manage the srava also with the same medicines. And Shamana Sneha, almost all cases goes with Shamana Sneha, and almost all cases have shown good result. Okay. And if there is kapha predominant condition, then administer Patola Katuroini Adikashaya or Arepadarishta. If there is Shota, if there is any inflammation and there is swelling, then in between for few days administer Punarnavasava. And if the lesions are dry, long term, Shamana Sneha with Amrutadikrita or Majishtadikrita. These two wonderful preparations, very pet preparation of me. And easy to prepare and administer a lot, and it's wonderful, giving good results. Okay, Piktamrita capsule is also good along with Manjishtadikara plus Kadirarishta, 2 combination. And Snana Churna. Here, if the skin is dry like this, see here you need to add little shati, a dry drug, and make a powder of it and add to your Snana Churna and apply it. It gives good texture for your skin, and it is having good fragrance also. See, this is the before and after treatment of eczematous cases. And this is for the hand, fingers, the lesions in the fingers is improved. Now coming to the varicose eczema, we get this case also a lot. Okay, this is statice dermatitis or statice eczema. It may show a complication of developing ulcer, and it may show the complication of becoming very thickened skin, like in the third photo you can see. Then that condition becomes verrucous. Verrucous is one of the conditions wherein skin will become horny like thing. It becomes very hard. Okay, so treating it is a long-term treatment, and once the patient is Visha, treatment can become successful, and we have 1 or 2 successful cases with us. Okay, management with as this is a circulatory disorder also. So Kaishora Gukulu helps a lot, and Kaishora Gukulu along with Manjishtadikara, Kadirarishta, and Arjunarishta is a addition for varicose condition. Okay, all 3 together administered, and Daru Haridra Patola Katuki Triphala Kashaya, freshly prepared Kashaya, 1 dose, 30 ml, 1 dose per day. Okay, and Amalaki plus Guruchi Churna Udvartana is suggested here. Jaloka Charna in a very chronic condition where the treatments are not responding, or in between the treatment, 1 day Jaloka Charna. And Capviscovaz and Cordorium plus liquid is also administered. And we have seen for at most 3 to 4 months, there is changes in the skin texture. If the varicose eczema has also associated with Brana, then Panchavalkala Kwata Prakshavana or Seka. After Seka, Jatya plus Branaharin, those 2 oils again, combination of 2 oils again, lukewarm and Brana Purana is done, Bandhana is done. Then daily mild Udvartana, because already there is ulcer. So see to it that it is not getting aggravated. So in that forum, mild Udvartana under your instruction, your keen eyes, the treatment has to be done. Mild Udvartana and Guruchi Churna and Amalaki Churna. Triphala Gukulu, Amrita Gukulu for long-term usage. Necrodha Adikashaya. If the ulcer is more, then opt for Necrodha Adikashaya. Or else just other kashayas are fine. Eshti Madhu Kshirapaka is also advised for in between few days. And after Shamana Chikitsa, here Rasayana, we need to add once the condition has turned for the varicose condition, then Rasayana Chikitsa is needed. Then after the Rasayana, 5 grams BD was administered. Okay. And this is one of the extra therapy. Takradara is one of the therapy for almost all the skin diseases, because the impact of skin diseases, as I said in the earlier slide, that it affects the psychological status of the patient. Controlling the psychological status also, Takradara is useful, and as well as the studies have proven that the process of Dara, making the mind so calm and relaxed, relaxed, and its effect on the skin is also same, and it forms the easy or quick healing of the lesions. And if you have plans for giving a combined therapy, you can add takra also. For here, for takra, we are adding Kushtagna Mahadravya Kashayas. Kashaya is added for the takra, and then dhara is given. It's not that the kashaya, usually it is an internal thing, but still externally for dhara also it is added. The logic behind it is we don't know, because this was taught to me from my senior guru, and I think this point needs some research. But results are little appreciated. It is supportive. I can say that it is a supportive therapy for your general shamana or shodhana and shamana chikitsa. Okay, so there are some. In the end, I would like to brief with little additional measures which you have to advise your patients, and they have to follow it daily. One is Mustadi Churna Prayoga, along with other treatments, other Shamana Chikitsa. If they continue Mustadi Churna Prayoga daily, has to be, it is one of the uh, good thing. Okay, as after 40s, many people have developed the habit of consuming Ayurvedic powders or kashayas in their empty stomach. Okay, so make it a routine of consuming Mustadi Churna for skin disease, skin patients. Likewise, you can even administer Amrutavalli Churna, Amrutavalli Churna, Guruchi Churna, and Amalaki Churna in combination. And you can administer either Kashaya or Swarasa or Krita also in Shamana form. Even Churna is also advised. Okay, and some other rasayanas, like as I think I have mentioned Tuvaraka. Tuvaraka you cannot give in the empty stomach. Ballat, Dhanvantara rasayana can be consumed. And the other rasayanas like Manibatra Kuda is there. And particularly for skin and the ಹೇಳಿದ್ರೆ rasayanas ತುಂಬಾ ಕಡಿಮೆ, because even Manibatra Kuda, though it acts as rasayana, it can be used for shodhana purpose also. Okay, so other rasayanas which is suitable for, even Amrutaballi is also rasayana, fine, also acts as rasayana. So that IS Kriti can be administered. Like that you have to plan. Okay, and Vajraka Taila for Abhyanga, daily Abhyanga Snana Madoritre, ಅಥವಾ ಈ ಕುಷ್ಠರೋಗಿಗಳಿಗೆ ಮಾಡಿಸ್ಬೇಕು ಅಂದ್ರೆ in between add Vajraka Taila. Then Aragudadi Kashaya ಸಾಕು. Okay, just to, these are all, you can either consider it as upakramas. Shashti upakramadalli ಕೆಲವೊಂದು ವರ್ಣ ಚಿಕಿತ್ಸಾ ನಂತರ ಏನು ಕೆಲವೊಂದು soothing things to make your skin look normal, come to the normal texture. There are certain things you have to do, and these things you can consider under that heading. Okay, and Khadira is a wonder drug, Ekamulika Dravya, for especially for Kushta. It is mentioned in our classics, and use it more for Pana or Parishik or Avagama, for everything. Add Katira in their daily routine. Okay, so one who indulges daily in healthy foods and activities, who discriminates the good and bad of everything and act wisely, who is not attached to the objects of the senses, who develops the habit of charity, who is of truthfulness, of pardoning, and keeping company of good persons, only becomes free from all diseases. This is from Ashtanga. This is a general statement, but very much applicable for the skin diseases, patients with the skin diseases also. Okay, this is very much needed for them, because slight apatya, you are showing improvement, and again if you indulge in a slight apatya related to the ahara or vihara, the whole process, disease process, gets back. So you should be very careful and be transform your person's mood swings or physical status and mental stability to our classical lines. Okay, and I end by saying that if our skin frowns, life itself frowns. Okay, so as a doctor, it's our duty to refresh, revive, and renew the skin. So once you have the happy skin, or once you have given happy skin to your patient, it is a happy being, and that's our motto. And I think I'll end by saying this. It is. I hope it was useful information by me, and thank you, one and all. Hello, ma'am.
Hello. Thank you, ma'am. Thank you, ma'am.
Thank you, Dr. Maitreyi, for such an elaborative and wonderful, sharing all your experience along with the classical references. It was really very interesting and informative. So I request students, if they have any queries, to kindly post your questions.
I hope it was useful information.
Yes, madam, definitely.
Yeah, of course, it was an elaborate thing. The case itself is like that.
Yeah, madam.
Itself is elaborate thing.
But it was really interesting, madam. Your clinical experience was really very good.
Yeah, though it is classical, we have made very milder changes in the classical therapy itself, and we are doing, and we're happy with it. I think there's no questions from our students.
Madam, there is a question, ma'am.
Yes, yes, please.
What about Nitya Virechana in Twakvikara? When can it be done?
What kind of? I'm not. It's
What about Nitya Virechana in Twakvikara?
Nitya Virechana in Twakvikara, yes. And then what was the second question?
When can it be done?
When can it be done? See, Nitya Virechana is not suggested. See, repeated Shodhana is of course advised for Twakvikaras, but Nitya is not suggested. And even only when there is Utklishta dosha avastha, then immediately to get rid of the doshas, you can administer Nimbamrutadi castrol, as I said, Nimbamrutadi Erinda Taila. And for Nitya Virechana, there's no such concept for Kushta Roga, okay? So because you should be very careful and not to make the Vata dosha get up. So go for Draksha. Only see, if you administer Avipattikara Churna, it will be very milder usage of the doshas going out. So that is fine, but not as a Virechana process. Okay, I think I'm clear.
Thank you, madam. I now request our principal, sir, Dr. Sarveshwarkar, sir, to kindly address all of us. Please, sir.
Madam, namaste.
Namaste.
Mythri, madam, namaste.
Oh, namaste. How are you, sir? Happy to see you.
With all your good wishes and prayer, I am fine here, madam. So we remember our very close colleague and presently also leading from the forefront at North Karnataka, my close friend Dr. Ramchandran Segi sir. We remember here, company at JSS.
Yes, sir.
So I also had a fortunate to meet him last time we met here also.
Okay.
And it's great also to meet you today in the knowledge session.
Yes, sir.
And more especially when professor from GMC Mysore is speaking, and that has got its own way of knowledge sharing, madam. Government Ayurvedic Medical College Mysore, and that again Department of Kai Chikitsa, PG Studies, and a professor is speaking. And that's the knowledge session what we listen today. I have with me my dean also. My dean also is sitting with me, professor, former principal of this organization, Professor Rajesh Utpudi sir also here, who is also a nobleman in Kai Chikitsa.
Yes,
he has got a lot of work in Kaisa also. And to give the drug also, Dr. Sharmaji, Professor Department of Peace Studies, Rasastra, they are also with me now. So on behalf of all the three, myself, my dean and my professor, Dr. Sharmaji, we compliment you, we congratulate you, and also we wish you that your knowledge of this disease, what you discussed today, eczema and etc., psoriasis, it's a really challenging one. Everybody knows about that, nothing to say more about that. And it's a stigma in the society too, because the suffering will be only understanding when we get little pain or fever or something like that. But having something like skin disease, Skin disease is something having the skin disease in the society. Many people they'll go for suicide, madam. I have seen in my 25 years of clinical experience, and people like you, those are having rich experience in clinical expertise. Definitely, I hope that the young generation, those are today listening this your guest lecture today, your knowledge session, they'll carry over your thoughts and your rich experience, madam, to their practice.
Yes, sir.
And on behalf of the department, you know, Dr. Bina is always proactive. Madam Bina, Professor HOD for Department of Panchakarma, is always proactive.
Yes.
And she guides the students, she see that the next generation is getting ready to soldier the responsibility of 2030. Madam Bina is preparing now 2030 integration with PM Modi ji.
Yes,
PM
sir.
Modi has got 2030 integrations.
Yes,
That
sir.
Madam Bina and their team is getting ready now for that.
Yes,
They are preparing the next generation to that level.
yes.
And quite good also, quite good. Madam, also one thing I want to share with you with a little bit of honor. This year also we received gold medal from University in the Department of Panchakarma.
Wow. Very nice, sir. Very nice.
This compliment goes to Madam Bina and their team also.
Yes.
And one more compliment also I want to share with you. In the Raghunath department, Madam, Dr. Subhash Chandra Bose, who is leading the department now in PG studies, all the three ranks, first rank, second rank, third rank, it is from our college only.
So nice, sir.
from JSS.
Sir, those
So, yesterday I was governing council meeting, so I submitted this. Therefore, the report is very fresh in my mind. I want to share with you for two reasons, because Ramchandra Rasiki sir has put the foundation for the organization in Department of Kai Chikitsa. He is the legacy maker. Rasiki sir.
Yes, sir.
So therefore, two things I really with the proud I share with you, madam.
Yes, sir.
Thank you very much. This is your 25th year. We are going to start it now. Sometime sales with the blessing of His Holiness. This is Mahaswamiji Suturmat. We are going to start the 25th year. You will be definitely coming here as an offline guest speaker from Mysore Government College. You can share the knowledge, madam. Once again, I sincerely request you.
Yes, sir. Thank you.
Thank
sir.
you all. Thank you, madam. Over to madam Bina, madam. As HOD, over to you, madam. Thank you. Compliment to all of you. Thank you.
Thank you, sir. So I think we have two more questions from the delegates.
Yes.
Please, Dr. Suma.
Mythri, madam, there's one question.
Yeah.
What could be the treatment for butterfly mask on face?
Butterfly mask on face, and they have written as Bang or Venga. If you're talking about Venga, it's a cosmetic problem. See, you have to take care, like for the oily skin people, this is seen more. And with the oily skin, if you're exposed to heat, like sunlight and too much of fumes, like hot fumes, Agni munde jasti kelsa madoರಲ್ಲಿ ಇದು ಜಾಸ್ತಿ ಕಂಡು ಬರುತ್ತೆ. So every day washing your face is thing. It's a very important thing. For washing, you use our powders or give a face pack of Yeshtimadu Haritaki. And for this, actually, we add very tender leaves powder of tender leaves of Nimba and Jambu. Okay, these four drugs have been, we get this reference from Shishruta Samhita. You just make a fine powder of this. For this, we even add some Varaniya Dravyas like Manjishta, Lodra, even rose petals we add and apply it over the face. Badam creams are showing good results for us. We use badam, dry fruit badami, the cream we prepare out of it, and thus you give the facial massage, and that is giving good results. A little bit of a wet pinch of Tankana Basma if you add for that, that also starts to take off the scar, because it is not, it is, the face is so delicate again, and the scar is so strong, it is not so easy. You apply for 1 week and your scar is gone. It's not like that. It stays for longer days. So take care every day, give a massage and pack and then wash. Okay. So just go on with this. This takes a lot of time. It's a long-term treatment and you'll definitely find mild improvement. Okay.
Yeah, madam. Thank you. There's one more question. Can you please elaborate on the administration of Tuvaraka Taila internally?
Internally, okay. Elaboration of this is, see, as I said, using Tuvaraka Taila should be done very carefully, because I always use it in a little lower quantity. Ballataka Tuvaraka, I kept it little at a distance itself, but under the guidance of my gurus, and now I'm doing it with a very mild form. See, I have used Tuvaraka Taila 1 karsha, that comes to around 10 to 12 ml. You can administer that much, but initially go with little quantity. Start with 3 to 5 ml of Taila. Taila, if you can prepare, fine, or else you can get it from the STM pharmacy. Okay, they have Taila preparation as well as they have some capsule preparation also. See, capsules and all, depending, you should identify the dosage, but go with the loose Tuvaraka Taila itself. Start with 3 to 5 ml. Okay, then see to the level of his or her digestion status, and that's why it has to be administered in between meals. Ahara madhyadalli administer, and always make your patient to follow very bland diet. Mudgayusha and the classical reference there, continuous adane tinni anta helidre, it will be little difficult for them. So advise them to go with follow the bland diet, and administer this Taila for 5 days, give a gap for 5 days, and again administer for 5 days. So make this intermittent therapy along with the other Shodhana and Shamana therapies. So in initial days, you practice like this, and I think and later on you will get to know how to apply this therapies in your patients. Okay.
Thank you, madam. One last question. In which stage annalepa should be done in exfoliative psoriasis?
Yeah. This we used to do for many patients, but as I said, you should be very careful, because see, the patient exfoliative condition, as I said, it is not, it can be little fatal, and the patients will have some rigorous chills history there and there. And for annalepa, if you want to administer it, it is actually to make the skin feel smooth and reduce the flaky depletion. That is the only concept to apply annalepa. See, even to make the skin very soft, there is the internet indication, and we have tried in few cases. That is the application of paste of cabbage leaves. Okay, cabbage, the paste has done, and that is applied. So we don't have classical references for these two conditions, but people are practicing, and what others do, and we also check it out whether it is appropriate or can we implement. Let us try. See, Anna, yeah, actually Shashtika Shali, if you make and then mix with Kshira and then apply, then it will definitely help the skin. But if it is plain regular white rice, it may not be so helpful. So see to it, if your patient is not having any fever condition, and if the skin is very dry, then only it is normal way of preparing the rice, boiling it. You can boil with Kshira also, then add some just not some. Actually, we tried with Nimba, but Nimba made the skin dry. So we stopped Nimba and we added Kadira. Kadira also dries the skin, but it should be very minimum quantity. And that combination you apply. And I told you it should be only for very short time, 20 minutes. That's it, not more than 20 minutes. Because if you leave the lepa, any lepa over the skin for 20 minutes, the doshas get settled beneath the skin again, and the condition, there may be chance of the condition to aggravate. So if it is for 20 minutes, the effect will be only to the level of the skin. So immediately after 20 minutes, it has to be removed and give a sponge bath like thing, and keep your patient warm. Okay, that's why I told you have to check. Every treatment needs check. Every time it has to be checked. Don't think that it is advised and you can do it daily. No. See every day that whether this treatment is helping your patient or not. If it's helping, then continue. See to it, you continue for 2 days or give a gap of 2 days and again apply for 2 days like that. Intermittently, these therapies are intermittently you have to administer. Okay.
Thank you so much, ma'am. I would like to now request Dr. Veena Jirao, ma'am, Professor and Head Department of Panchakarma, to kindly address all of us. Ma'am, please.
Thank you so much. Good afternoon, everybody. Namaste, madam. Dr. MYTHREY, madam, namaste.
Namaste, ma'am.
So since lockdown, even in the first wave and in between, so we were continuously doing like the webinar sessions, so even in the international seminar webinar and all. So now it is the second time lockdown in the during the second wave, and we have again started a series of lectures. And last time, Dr. Rajalakshmi madam from STM Udupi, she has delivered a lecture, and it is our privilege to hear you like a wonderful lecture with your vast experience about 20 years of clinical experience in treating the patient of dermatological disorders. I always think of you calling to our webinar, and today we have taken this opportunity to hear you, ma'am. So with your experience, you have shared the treatment of different varieties of psoriasis, tinea, and even the eczema. So the lecture is wonderful and highly practical oriented, and it's a hats off to you for such a great experience. So I thank you, ma'am, for your experience today in our platform for our students. Thank you. I thank our beloved principal for his constant support in conducting the series of lectures from our department, that is Department of Panchakarma. And I thank all the staffs of Department of Panchakarma, even other department staffs, and all the delegates who have made this a webinar lecture success. Thank you. Thank you, one and all. Thank you.
Thank you, ma'am.